Hey everybody, Dr. Kevin again here with Balance and Body Restoration Physical Therapy and Massage. We are a clinic located in the East Bay of California in a city called Dublin. And today with me is my wife Tweet, who is also our deep tissue and trigger point massage therapy specialist. And today she's going to help guide us through some of the exercises for today. So the exercise that we want to go over today is a very popular exercise for core strengthening known as the plank. And the plank is a very popular exercise. It's very effective at helping you develop core strength. And it's a very popular exercise in rehabilitation because it's supposed to help you develop strength in your core, to help take pressure off of your spine by just giving you more support and just more strength in general. But I also believe that the plank is one of the most misunderstood exercises in terms of form and technique, which can cause quite a few problems for patients, especially if people are trying to rehabilitate their spine, because when done incorrectly, it can also create a lot of pressure and a lot of strain on the spine in ways that can be avoided. However, when the exercise is done correctly, I feel it is one of the most effective exercises at developing strength in your core and also helping take pressure off of your back. So today I want to spend a couple of minutes just going over some of the most common mistakes that I see people make when they're doing the plank, and also to show you what I believe is the best form and technique and how to approach this exercise, just to help you maximize the effectiveness out of the exercise while also making sure that we keep things as safe and as simple as possible. So let's get right into some of those common mistakes, and then we'll go into the form of how I believe the plank is best done. Okay, so the plank exercise, if you're unfamiliar with it, you can just kind of start in your hands, your knees position, and then just get off of your knees into this push-up position. This can be done one of two different ways. You can do it in this kind of like on your hands when you're in a push-up position, or you can also go onto your elbows into your forearms, which can be beneficial if you have some wrist problems or if you have some wrist pain. So, so I'd say that the most common mistakes that people make, and we'll just go back into the push-up position. The most common mistake that I believe people make is they're just not paying close enough attention to the form, the posture, or the overall position of their body when they're doing it, which can just start to cause a lot of problems. So the most common mistake that I would see people make, instead of just kind of holding an upright position, is exactly, we see a lot of this where people are not attentive enough to their back, they're not attentive enough to their core, and their backs and their hips start to sag. And over time, going to let the back sag a little bit more. Over time, this can be very painful and very problematic because a lot of stress, a lot of strain, and a lot of pressure can start to build up in the back in ways that people are just unaware of, okay? So you can go and rest for us for a quick second. And I would say that the second mistake that people make is that they're just holding on to the form, they're just holding on to the position for way longer than they should. So it's very common for people to say, oh, you should hold the plank for a minute, and then you should try to hold it for 2 minutes. And while I believe that there's no problem with with trying to hold the plank as long as you can, there's no problem with challenging yourself, there's no problem with pushing yourself, but I believe that there are problems if you don't have a good core understanding of the proper positioning and the form and the technique, because if you hold the position for too long and it's potentially stressful on your back, then those are things can lead up to just unnecessary amounts of force, unnecessary amounts of strain, and could lead to actually pain in your back that we would absolutely want to avoid. So let me just give you a couple pointers of how I generally teach the plank and what I believe are the most effective ways possible. So let's go up into the push-up position again. And again, the first thing that I would want you to focus on is to make sure that you try to keep your hips up a little bit higher. So bring your hips up a little bit higher. So try to keep your hips as close to in line with your shoulders and your overall back as possible. You want to try to assume a tabletop position where your back, your shoulders, and your hips are all just as level as possible. And you also want to make sure that you're not letting any arching or any sagging happen through the back to make sure that you are engaging your core actively the entire time. Now, to really maximize the effectiveness out of this exercise, go ahead and squeeze your glute sweep and go ahead and grip your fingertips into the mats. And we want to bring a lots of conscious engagement of your glute muscles and also your core muscles, just to bring more conscious activation. And this will really start to supercharge what your muscles feel during the exercise. So hold it for 5, 4, 3, 2, 1. And as you can see here, her back isn't sagging. Her core is very, very tight, is very, very secure. Go and take a break. And this is going to just bring a lot more neurological strengthening, because you're just paying so much more active concentration to just making your muscles turn on, which again is going to bring a lot more value to the exercise. So let's just show it one more time so you can do it this time on your elbows. So this is the other variation that's commonly taught in the event that your hands, your wrists just can't hold up to the position. And again, just lower your hips just down a little bit. You want to make sure your hips aren't too high, but she's doing a really good job of making sure that her back isn't sagging. Because once the back starts to sag, that can bring a lot of unnecessary strain to the lower back. Again, squeeze your glutes as tight as you can, hold that tight. Now go ahead and try to pull your elbows down towards your knees and really try to squeeze those abdominal muscles as hard as possible. So instead of holding a minute, just start to aim for, in the beginning, just 10-second holds, okay? 9, 8, 7, 6, 5, 4, 3, 2, 1, and rest. Excellent job. So she was able to hold pretty good form, pretty good technique. Her back wasn't sagging at all. And again, we generally advise people to start by learning how to hold a proper plank for just 10 seconds and then start to build from there. Even if you just do 5 to 10 reps of 10-second holds, that's far superior than trying to hold a plank for a minute with improper form or improper technique. Once you have a good knowledge, once you have a good foundation of what the exercise should feel like, which means a lot of engagement through your core, a lot of tension through your glutes, then try to advance up to 20 seconds, 30 seconds, and start to advance from there. So that's it for the plank fundamentals and form. I hope you enjoyed, and I hope that it helps with your rehabilitation programs on your own as well. So take care, and hope to see you again next time.